Chapter 23, Respiratory Anatomy, Screencast 2. This screencast will be focusing on the remainder of the upper airway. The first structure that we'll look at is the pharynx. The pharynx is a funnel-shaped passageway. It can be found posterior to the nasal cavity, oral cavity, and the larynx, and we can see that here. The lateral walls are actually composed of skeletal muscle, and the three regions are actually subdivided based on their location: the nasopharynx, the oropharynx, and the laryngopharynx. The nasopharynx is the most superior part of the pharynx. It's found posterior to the nasal cavity, yet superior to the soft palate. The nasopharynx is lined by pseudostratified ciliate columnar epithelial tissue. The important thing to remember here is it is a passageway for air, not for food, unlike the other regions of the pharynx. As we swallow, the soft palate will actually elevate and block food or drink from entering. It also will connect to the middle ear via the auditory or eustachian tube, and this opening tubes allows an equalization of pressure on each side of the tympanic membrane. Also, you'll find the tonsils there, and they would be the pharyngeal tonsils. And once again, we talked about them previously. They are infection-fighting lymphatic tissue. The oropharynx is going to be the middle region. It can be found posterior to the oral cavity, and it extends from the soft palate to the hyoid bone. This is a passageway for both food and air, and as such, it will be lined by non-keratinized stratified squamous epithelium. There are also two sets of tonsils that can be found in the oropharynx. Those are the palatine tonsils on the lateral walls, and then the lingual tonsils, which can be found at the base of the tongue. Now, the laryngopharynx, that is the inferior, and it is the narrow region of the pharynx. It is posterior to the larynx. It can be found from the level of the hyoid down to the esophagus. It also is a passageway for both food and air, so it also is going to be lined by non-keratinized stratified squamous epithelial tissue. The larynx is the voice box. This is a cylindrical airway between the laryngopharynx and the trachea. There are a number of functions that are associated with the larynx. One of its more predominant functions is sound production. This is due to vocal folds which actually vibrate during expiration. It acts as an air passageway. It also prevents ingested materials from entering the respiratory tract, and this is due to the epiglottis. And the epiglottis actually covers the superior opening during swallowing. It assists in increasing pressure in the abdominal cavity. This is done via the Valsalva maneuver. During this maneuver, the vocal folds close off and contraction of the abdominal muscles. This results in increased pressure, and it facilitates urination, defecation, and also during childbirth. It participates in the sneeze and cough reflexes. These are reflexes that help remove irritants from the nasal cavity or lower respiratory tract. This occurs when the abdominal muscles contract. There is an increase in thoracic pressure. Vocal folds are forcibly opened due to the pressure from the abdominal cavity, and there is a blast of exhaled air as a cough or a sneeze. Here we can see the overall anatomy of the larynx. We're looking at three different views. We're looking at an anterior view, a posterior view, and a posterior oblique view. Here we can actually see that a major contributor or portion of the larynx is cartilage. So there's an awful lot of cartilage that we can expect to find within the larynx. Here we're basically looking at the vocal folds, and what we can see here, a number of the cartilages that are involved, but we also see the vocal ligaments, and they also will be called intrinsic ligaments for the most part. And notice their position. They are actually covering, and found in the middle of the glottis, and so they will actually vibrate as air moves through them. Here we see a different view. This is through a laryngoscope. We can actually see the vocal folds, and off to the sides we can actually see the vestibular folds or the false vocal folds. Now, the role in sound production is due to the vibration of the vocal cords. Keep in mind that there are intrinsic laryngeal muscles that narrow the opening of the rim of glottis, and that is the space Okay? Air will be forced past the vocal folds during expiration, resulting in sound. Range of voice is determined by length, thickness of vocal cords. Males have longer and thicker folds. This results in a deeper voice. Folds also will increase in length with growth, deepening their range, and this is especially seen during puberty. Pitch is determined by the tension on the vocal cords. The greater the tension, the greater the pitch. So higher tension, there's a greater vibration, higher pitch. This will be regulated by the intrinsic laryngeal muscles. Loudness actually depends on the force of air passing across the vocal cords. The greater the volume of air, the greater the sound, or the louder the sound. Now, there is a clinical situation that is tied into the larynx, and it is laryngitis. And this is an inflammation of the larynx, and the symptoms typically are a hoarse voice, sore throat, could be a fever, depending upon the underlying cause. It could be caused by bacterial or viral infection, but also overuse, so speaking loudly or a lot, will actually result in inflammation. Severe cases can actually extend down to the epiglottis, and this would be especially important or dangerous because it may lead to sudden airway obstruction, especially in children.